Um, so in terms of the damage that occurs, we talked about some of the enzymes, some of the molecular things. We also know that there's structural changes in the autistic kids. And then I like to kind of bring that in here. Then there is the behavioral aspect of it. Of course, the kids that have, we didn't talk about the neurotransmitter changes, that goes without saying, sort of that when the enzymes aren't there to either dismantle neurotransmitters, like in methylation, or to make neurotransmitters, you get a pattern of neurotransmitters that's not normal. When I went to medical school, there were only 3 or 4 neurotransmitters. There was acetylcholine, adrenaline, noradrenaline, dopamine, and serotonin. That was it. Now we know that we got over 100 different neurotransmitters. There is substance P, there is somatostatin, there is nitric oxide, neuropeptide Y. There is a whole host of other peptides that the common person wouldn't have heard about, because the education of the common person is done by people like myself who went to medical school over 30 years ago and are not in line with the new thinking. But there's over 100 neurotransmitters. When Candace Pert wrote her book, Molecules of Emotion, I think at the time it was around 70, and the book is only about 8 years old. Now it's over 100, so they're still being discovered. And we know that the enzymes that regulate the neurotransmitters are all disturbed. And we know that we can basically determine somebody's behavior by simply measuring the neurotransmitter cocktail that's in their blood in that moment. If you have a certain amount of serotonin and epinephrine and dopamine and adrenaline in certain proportions to each other, you may experience the feeling of fear. If you adjust the doses a little bit up and down here and there, you may experience the emotion of love. And you adjust it a little bit differently, the emotion of anger, and so forth. So our feelings and our behaviors resulting from these feelings are largely determined by the amount of neurotransmitters. Okay. Now, what regulates it is the mind and the higher cortical functions, the spirit, the soul, but it can only work if the enzymes ultimately, the downstep or the higher processes into biochemistry, if the enzymes work. Now, what we do know, and you, I think, bring that out more than anybody else in your writing, is the fact that autistic kids have a completely healthy and normal soul, that intelligent soul that wants to work through this body and express itself in real life. But it cannot make the body work in ways that it wants it to work. So the body walks off in odd different behaviors. And there's incredible stress and suffering in these kids on the inside, because what their soul knows and the intelligence that their soul has cannot be converted in appropriate action. And somewhere in there, the link is the neurotransmitters. And they're disturbed again because of the disturbed enzymes. So that brings it to behavior. Behavior is largely driven by our emotions and has all to do with both the feelings and the mind. How is the mind and the feelings translating themselves into action that creates our behavior? And many of the treatments in conventional medicine have focused on behavior modification in one way or another. That means it's basically making these kids more pleasant to their environment. I have not seen these treatments to really affect the soul and really create a happier child. It creates a more functional child, and functional always means the perception by the environment is, this child is less disturbing to us. But does it translate into happiness and fulfillment? I don't think so. However, there's also a feedback loop. When you change somebody's behavior, the pattern of neurotransmitters that occur in the blood and the neurotransmitter responses that occur change. So by changing a behavior, you also have an effect on the enzymes that regulate the neurotransmitters and so forth. So there is a feedback loop in that. So I don't want to put behavior modification down as a treatment completely, but it's certainly, if you talk causal treatment and symptomatic treatment, behavior modification is on the surface of the symptomatic treatments. You know, it's not a deep treatment, it's not affecting autism at its core. And it is very convenient for the government to pay for behavior modification because it insinuates the idea that autism is a behavioral disorder based on psychological dysfunction in the family, and therefore the government is not responsible. When you bring it back to the issue that these kids have been poisoned by government mandate, by the vaccines, and by the environmental pollution created, sanctioned by the government, or even at profit for the government, then it looks very different. So any of the official intervention in conventional medicine will be aimed at looking over here and not looking over here. You know, and so that's my job and the job of a couple of us more suicidal physicians.
Don't say that out loud.
To point out the hypocrisy that's in that also, and therefore I become an enemy of behavior modification. Not that it doesn't have a small role in it, but because it's been used as a political tool to distract from what is important. Yeah? So one of the outcomes of autism is abnormal behaviors, yeah, based on some of these mechanisms. And then what I like to discuss here also is then the tertiary damage that occurs. Yeah? Because if a child now has abnormal behaviors, it doesn't make friends. And if you don't have friends and interaction, you don't learn. And if you don't learn, you don't get the stimulation of normal, healthy brain growth and neurotransmitter development and soul development. And you're entering a vicious cycle now, where the symptoms caused by the primary issue, you get the secondary issue. And the secondary issues create now an abnormal life where you do not get the amount of social interaction, love, stimulation. The nutrient input is greatly impaired because of the food choices, so difficult with an autistic child. They don't eat what you offer them because of disturbed abnormal behavior. Because of that, they get biochemically more and more depleted, and you're now in a vicious cycle that sustains the illness and makes a repair very, very difficult. Yeah? These are the tertiary damages. Yeah? So we got the causal, the primary, we got the secondary outcome from that, all the things that happen because of it, the vitamin B deficiency, B12, folic acid, the enzyme damage, the RNA damage, and we can't spend a whole lifetime trying to fix the secondary damage if you're not addressing the first one. You know? And then we have the tertiary damage that comes because of the changed lifestyle. We're having now trouble with food intake, we have trouble with the digestion often, so there's further, you know, they're often constipated, the kids, so they have a further build-up of toxins. The social interactions are missing, they're not going to normal school, they're not going to university, they don't have friends, they're in their own family, they're looked down upon, they don't have an equal place to other siblings. They spending more time in the home than the other kids, and the home may be toxic, and therefore they're even more exposed to the toxins that cause their illness in the first place. And it's a tertiary vicious cycle that these kids are exposed to. And treatment, of course, needs to address those issues. It needs to address the secondary issues, but it must never miss the primary issues. And so, in this book, in our work together, we want to not lose track of it. Where are we with the treatment? You know, and most of the treatments you brought to me are mixes, you know, on all these three levels. And we sort of want to, I think, more clearly differentiate the three levels. And just sort of, you know, using the writing that you already have done, but looking, combing through it and kind of say, okay, this belongs here in this middle section, or this is like really tertiary outcome, which you you're very aware of, and you hardly mention it. You kind of mention it with a sentence here and there. Say, oh yeah, by the way, yeah, this happens. And I love the the way you're one of the few moms who understood causal, primary, secondary, and tertiary, and really addressing the primary issues is, I think, is something we should go over now, like sort of, and I like to work with the toxin exposure, just make it very practical. Here's the issues, here's what we can do, and then talk about detoxification, here's what we can do, and then jump through, okay, now we have this damage here in the middle, what are all the things that we do? And you have a whole list, of things that you brought to me that are fantastic, and like far more about it, but I like to discuss them and then answer your questions to those things, but always against the backdrop of understanding the system. Toxins in, toxins out, things get stuck in the middle, causing damage, and then we're doing damage control with many of these techniques. And some of them are just sort of on a vicious cycle level down here. So I want to, throughout the book or the next day and a half, sort of when we do our discussion, always sort of when you ask me questions, or depending on how we do this, always go back to these simple ideas, because because the truth is so simple,
right.
And the truth is very inconvenient to whoever is sort of in control of politics. It's very inconvenient, the truth, and it's much more convenient to look at that middle section. How much vitamin B, how much amino acids do we need to give, how much
more money there
antibiotics. This is where the money is made, in the middle section. And this is why I admire people with the courage of Dr. Buttar and others, or on one end is the Academy of Environmental Medicine, the people that have really kind of brought the knowledge to us and monitored, the toxins in, leaving out a few pieces, but that's covered pretty much in one group of physicians that have been courageous and wonderful, but they haven't gotten this piece. The worst group in terms of detoxification is the American Academy of Toxicology and all those established group of toxicologists who haven't produced one single solution for us. All government-funded institutions haven't produced one piece of a valid detoxification program. In fact, they're the ones that sue everybody when they try to bring in detoxification drugs that are used in Russia or China or other countries successfully. So the organized groups on this end of detoxification have been an obstacle rather than a help.